Hello and welcome to Health Professional Radio. Our guest is with us from Massachusetts General Hospital in Boston, Dr. Ebru Oral, here with us to talk about her presentation at the recent American Academy of Orthopaedic Surgeons meeting about vancomycin. Welcome to Health Professional Radio, Dr. Oral.
Thank you very much for inviting me. I'm glad to be here.
So, what is your role there at Mass General?
I am a research scientist at Mass General Hospital. My background is in chemical engineering. I have a PhD, so I am not a medical doctor, but I work in very much in the clinical environment. I am an assistant professor of orthopedic surgery, and I'm also the associate director for biomaterials development at the Harris Orthopaedic Lab at Mass General Hospital. A little bit of background about the Harris Lab. We were founded by an arthroplasty surgeon, a prominent one, Dr. Harris, and therefore our core competency and our historical work has been on arthroplasty itself, so total joint replacement. And our laboratory is very translational in nature. That is, we have subgroups where we take ideas and concepts for materials development from the benchtop all the way into the clinic, and we follow up patients as well. So my group works on the sort of more bench side of things, that is idea conception, proof of concept, some preclinical testing of safety and efficacy. And then we also have other groups in our laboratory that have expertise in prototype design and device testing. And we try to support IP development as well as regulatory submissions such that we can bring these ideas into the product stage and with some partners bring them actually into the clinic.
You recently presented at the American Academy of Orthopaedic Surgeons meeting concerning vancomycin. Now, vancomycin has been around for a while. What were you discussing as it relates to recent developments surrounding vancomycin?
So let me give you a little bit of background on the subject, which is periprosthetic infection. So the materials that we're developing currently, we're really interested in addressing this morbid condition. This is a type of infection that occurs after a total joint replacement. So currently in the U.S., there are about 1 million patients yearly that undergo hip and knee replacements, and a very small fraction of them, 1% to 2%, but that's still a large number if you consider the total number of people undergoing this surgery, get an infection mostly within the first 2 years of the implantation. And currently, the gold standard for treating such infections involves a 2-surgery procedure. So in the first surgery, all of the implants are removed from the patient and the bacteria are cleaned as well as possible. And then there's a period of time where the patient is treated with antibiotics, both by IV and also locally with antibiotics, including vancomycin, locally in a matrix called bone cement. This period of time is meant to be about 4 to 6 weeks. However, in most patients, this can go up to about 3 months, and the patient in this period of time is quite limited in their weight bearing. And then after this period of time, when the patient is cleared from the infection, then there's a new procedure where new implants are implanted, so everything is renewed. So as you can see, this 2-surgery procedure is quite traumatic for the patient. It's a long process as well as costly and not very ideal. So we wanted to first develop a bearing surface made out of polyethylene, which is the typical bearing surface that is used in these implants. And we wanted to be able to deliver the antibiotics from this bearing surface, as opposed to bone cement, which is a fixation device and is not meant to be load-bearing. So if we can do that, then perhaps we can eliminate the 2 surgeries and do the treatment in one single surgery and leave the bearing surface in there to elute the antibiotic and treat the infection. So the 2 posters that I presented this year at the Academy were based on vancomycin as well as vancomycin and rifampin eluting polyethylene. So we prove the concept that we can do this, that we can elute from the bearing surface and be effective against some of the most common bacteria that are seen in these infections.
Is there any consideration as to the age of the patients?
We have a long history of developing polyethylene implants, and so there are several different properties that we really have to maximize for the material, and so we were focused on that. But there is there's really no reason why these implants cannot be used for the indication of infection for the patient.
Now, are these preventative of infection, or do they make inevitable infections much easier to handle and vanquish? Is that an aspect of the product as well?
So currently we're focusing our efforts on treatment because, as I said, the current gold standard treatment is not ideal. However, prophylactically, that is to prevent infections, we could use similar type of implants. However, the surgeons and the community at large is very much interested in the risk of resistance to some of these drugs, and putting them prophylactically in the joint has some concern. So that, I think, is a longer-term prospect. But technically, we can certainly use these materials and modify them so that we can use them for preventing infections as well.
What was something else that excited you that correlates with your presentation, and maybe in the future collaboration may take place?
So with respect to infection specifically, there are new methods that are being developed to actually identify infections, which is another area that requires some work. There are still about 20% of infections in patients that can be culture negative. That is, the bacteria that infects the joint is not known. So there's a technique called NGS, or next generation sequencing, that I'm very excited to see where it's going to go, because it can help us in identifying infections a little bit better, it seems. And then another area that's directly related to what we do is pain, because we are also interested in addressing pain with this type of implant material, with instead of antibiotics, using analgesics in the bearing surface. And I'm glad to see that there was a lot of interest, I think, in now quantifying how much pain patients feel after the surgeries, and related to that, how much pain medication they're using. So with some close look at these concepts, I think we'll be able to develop some thoughtful materials and methods for addressing that condition as well.
Where can we go online and get some more information about the Harris Orthopaedics Lab there at Mass General?
We do have a website. I think any search engine with Harris Orthopaedic Lab at Mass General gets to it. It's www.harrisortholab.com.
All right. Well, I sure appreciate you coming in and giving us this great information. I'm hoping we'll talk to you again in the future as things develop. And it's been a great interview. Thank you so much for taking the time.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.